Hi everyone, welcome to the Where To podcast, where we will answer all of your Where To questions. We are here to discuss mental health and resiliency with you in order to help you live the best life possible. Let's get started.
Welcome back to another episode of Where To with PFH Prevention, where we explore all things resources with our prevention department. I am April.
And I'm Kylie.
And we are Missouri Show Me Hope Crisis Counselors with the Missouri Crisis Counseling program. Today we have Dawn Johnson with us today to talk about some mental health resources with our veteran population. So Dawn, do you want to kind of tell us a little bit about you and your position and your experience?
I joined the Army my senior year of high school. I spent 9 years enlisted, and I worked as an administrative specialist in a blood donor center where I cross-trained and also did phlebotomy. I changed my MOS and became a preventive dentistry specialist. I was a staff sergeant when I took my direct commission and became a medical logistics officer, and I did that for 9 years. I was a captain when I was medically discharged in April of 2018. I currently work for Preferred Family Healthcare as a mental health training specialist.
Wow, that's super impressive.
It's a very long list, much longer than mine.
Yes. So with each one of our episodes, we try to do a get to know you question for not only us, but our guests, so our listeners can kind of learn a little bit about us. So what is one thing that's on your bucket list?
I want to do a motorcycle tour of Germany.
Oh,
wow.
That sounds like a lot of fun.
Yeah.
Can I join? Just kidding.
Ride on the Autobahn?
I have a mini motorcycle. I can just ride next to you. No.
I have a bicycle.
I have a Harley.
Bicycle. Oh gosh. April, what's something on your bucket list?
One thing that is on my bucket list would be to visit every Major League Baseball stadium in the United States.
Oh, that's good.
Fun.
That does sound fun. My bucket list isn't too exciting. I want to go to Greece. I kind of want to live out Mamma Mia in real life. But yeah, I really want to go to Greece. Yes. So to kind of go into the questions that we have for Dawn, how has the pandemic impacted the veteran population and services?
So before the pandemic, I remember going to the VA and seeing crowds of people all waiting in the waiting room. You'd sit there and meet new friends, compare stories, and get a sense of camaraderie. But since the pandemic, the clinics, there's less availability. There's very few people in the waiting room. There's stricter guidelines, and there's an increase in video appointments.
Yeah. Telehealth stuff?
Yes.
True. So I know you talked about kind of your experience. You've got a broad amount of experience in different different aspects and stuff. So what do you think and what you've seen is the biggest need for veterans, the biggest resource that's needed out there?
I know that the pandemic has had a negative effect on veterans' mental health. Servicemen and women like to bond. We might meet as strangers in the waiting room, but we all raised our right hand and we all laced up our boots. When we walk into a nearly empty waiting room with chairs spread out, we don't get that bonding, and it's hard for us to hear because most of us have tinnitus, and with the chairs 6 feet apart and wearing a mask, it's difficulty to have that bonding experience.
Yeah, absolutely.
And that's something that definitely hit a lot of people when COVID happened, was just not being able to bond with people and make memories.
Right.
And just being able to talk to people was limited. So, yeah, I could definitely see that. How can veterans or active duty military members connect with resources or become familiar with what resources are available to them?
So the VA has a very helpful app. It's called VA Launchpad, and that helps you connect with your primary care, mental health, and other resources.
That's awesome. Is it easy to navigate or is it kind of difficult?
Yeah, it's pretty simple, and it's in all the app stores.
Cool. I didn't even know that anything like that existed, so I'd imagine maybe a lot of other people might not have known that either. So.
Yeah, with the app, that's really good to know because my dad was in the Marine Corps for 30 years. And so from him, we got a lot of education benefits. So I used that with my schooling. And being a dependent with the VA was a lot easier than I expected because it was a government agency. And so I was like, it's going to be really hard. But the VA definitely helps in a lot of different ways. And they've helped my dad every single time he needs it. Like they're there for their people whenever. So it's really good to hear that. They are there for you, for other people, for everyone.
My daughter uses the dependent education benefits as well. So.
It's awesome.
Oh, yeah.
Could not have asked for a better setup. The military is great. If you plan on joining, join.
Okay. So, are there any helplines, organizations, any type of phone numbers that people can find, reach out to get resources and get some, find out more things, get some help?
So if you go to mentalhealth.va.gov, there's a list of resources that's available for veterans and their caregivers. The Veterans Crisis Line is 800-273-8255, and you need to press 1. Or you can text 838-255 for the crisis line as well. There's the Women's Veterans Call Center that you can call at 1-855-VA-WOMEN. And there's the Caregiver Support at 855-260-3274.
So those are a lot of resources that you can get a hold of, or if you know someone that needs those resources, you can direct them to any of those because I'm sure they're all very, very helpful.
And always, if you do want more information about some of the things we talked about today, maybe some more information about veterans resources specifically, you can always reach out to us at MoPrevention at pfh.org, and we would be more than happy to direct you and kind of hook you up with some of those phone numbers, hotlines, whatever you need.
Game on!
Yes, so now it is time for our trivia segment. Okay, so this week I decided to have a theme. So it's animal theme. And the first question is, how many bones do sharks have in their body?
They have cartilage, don't they?
I don't know. I didn't look that
You
up.
don't know I was like, you don't know the answer?
No, I know the answer. I didn't look up if they have cartilage.
I didn't think they had bones. I thought they had cartilage.
April, what do you think?
I didn't think they had bones either. Is that a misconception?
No, that's true. They had 0 bones. 0. None, not a
Really
joke.
make me second guess my knowledge.
No, yeah, your shark knowledge is to the T. The second question is, how many hearts does an octopus have? Or do they only have 1? Or none? Who knows? I do.
These trick questions.
I'm not sure.
April?
I'm gonna say this. I know it's not true, but I'm gonna say they have 8 because they have 8 legs.
What? What? 8? Dawn, if you could give any number, what would it be?
It's not 8.
It can be 8, yeah. And obviously not
3.
0. Are you kidding me? It is 3.
What?
April wrong. 8
I was
hearts
wrong.
in 1 octopus.
I was so wrong. It's fine.
That's okay. I really thought it was just 1. So, if you have an octopus, it has a lot of love for you, I guess.
You have an octopus.
It has 3 hearts. I shouldn't be able to talk.
You can leave that part in there.
Okay.
All right. So, upcoming events. Saturday, July 31st. That's right. We will have our prevention party in the park in Kirksville, Missouri, at the Rotary Park, the amphitheater. It's going to be so much fun. We're going to have free food, free prizes. It's going to be a great, fun family event. Bounce houses, cotton candy, snow cones, all kinds of awesome games. So make sure to come on out and participate and get some awesome goodies.
So we have QPR and mental health first aid trainings, and you can always join some of those as well. But yes, thank you so much, Dawn, for joining us. Really appreciate that you took your time out of your day to join
Thanks
us.
for having me.
Of course.
All right. So thanks everybody for listening, and we hope you join us next time.
Thank you for listening to this week's podcast on Where To. This podcast was brought to you by Preferred Family Healthcare Prevention. For more information about PFH prevention, please visit our Facebook page at Preferred Family Healthcare Prevention. You can also find our YouTube page at Prevention PFH, or email us at moprevention@pfh.org. See you next time.